And this morning I want to show you a minimally invasive surgery that we can compare head-to-head to a traditional surgery for a bunion correction. And let's kind of look at her feet. We look at her right foot here. You see she had a traditional surgery done some years ago with an incision, a fairly long incision, about 7 centimeters. And basically some work in here with fixation. And you can see the result they got there. Good result with the right foot. She decided to have her left foot done, and we did this through minimally invasive surgery. So what we did with her, went to the side here, made a percutaneous incision here, and we did a Seri procedure, that's S-E-R-I. This procedure, I've modified a little bit to where the fixation is slightly different, and in fact better than the Seri way it's described with the Seri. With the fixation we use, we bend the K-wire into a Z form, which allows us to also perform an osteotomy on the hallux. And it is fixated just like the Seri, but it X's the skin here, and we're able to modify our toe by pushing it over as far as we want to and still get the stretch we get with the original Seri. And also we do a percutaneous fixation through this skin this way to give us double fixation. That way we can keep the metatarsal head plantar flexed. So we can look at her that she's about 3 months out now, so we still got real good range of motion in the foot. You don't get that tightening you get with some of the other open procedures. Even with this foot, they actually maintain really good motion. So it's not that the MIS is better. If you do either one of them correctly, you'll get a good result. It's just this is a lot quicker and easier on the patient. When we did this surgery, she was able to actually go back to work fairly quick. She works on her feet a lot. So let's just ask her too. You can see the difference in what we got with our corrections here. I actually got a little bit better correction with the abductus on the left foot. But let me just ask her a question. Now, going back in time when you had this right foot done, how was the recovery with this right foot compared to the MIS surgery? Which one was easier for you?
Easier on the left foot.
Okay.
The right foot, I had to spend about 8 weeks with my foot elevated.
Okay.
Therefore, I had to work with my foot elevated.
Right.
And I can't do that anymore.
Right.
That's why I chose the other procedure.
So with the left foot, you were able to go back to work.
Right away.
And so she went right back to work with this, and she's up on her feet a lot at her work. And so this was a much easier recovery, and that's one of the goals of MIS surgery, is to have a quicker recovery in terms of not so much post-operative time away from work or time from normal life. So doing well now, back into normal activity. And we're just waiting for it to completely heal inside. It looks really good, and remodeling's already started.